How can we control the mosquitoes? Mosquitoes are the vectors. That is what we are speaking about, vector management. Okay, mosquito control measures. Environmental management, mechanical management, biological control, chemical control, personal protection measures. Okay, these are all the different types of control measures. So, in the environmental management, source reduction. You know source, how to reduce the source, whether to remove it or emptying water container. So the source should not be there in the environmental management. Source reduction.
Problem
weekly. Okay. Drying day. So now only Sar is telling about the dry day, na? Here see, drying day. We should maintain weekly one dry day so that we can stop the laying of means the development of the life cycle of the mosquito. Yes. Okay, filling, clearing weeds on means weeds or water body streamlining, whatever it may be, the source should be reduced. That is the environmental management. Coming to the mechanical control. Mechanical control means putting mesh to the windows, doors, screening, drilling. If drainage is there, you have to drill holes so that the water will not clog. It will go. That is one mechanical control. Biological control means larvivorous fish. Okay.
Gambusia, guppy.
Yes, guppy fish, gambusia fish. These are all larvivorous, and also some biological larvicides are also there. Plant products are there that can be used as the biological control. Second one is chemical control or insecticide treatment. As you are experts in malaria, you are doing indoor residual spray. You are using so many chemicals. Okay, DDT, malaria, you know all this.
Comes in this
So, yes, what chemical we are using comes under the chemical control. So, use of chemicals or larvicide applications, adulticide applications. So what larvicide to be given, what adulticide to be given, I will give you one chart. Okay, in that chart everything details will be there. Anyhow, I will give the presentation in that all chart. If you have any doubt, you can see that image, so that you can know what pesticide means, what insecticide to use. Okay. Next one is personal protection measure. We are using daily, yes, odomas, etc. Some mosquitoes 3 days, 4 days. So egg will hatch in 1 or 2 days. That larval period is around 3 to 4 days. In larva again 4 stages are there. L1, L2, L3, L4. They are instars. So they grow on sizes, increasing the size. There are 4 instars. Okay, that I will 4 instars. So that will take around 4 days. On an average, 2 to 4 days. Next, from pupa, it will be there in 1 or 2 days. That's why pupal index we are calculating. Indices, Bruta index, house index, container, same pupa index is also there. In how many dips you are collecting, how many pupa will come, you have to count actually. Why we are counting pupal index? Pupal stage is only around 1 or 2 days. It will emerge as adult and start biting. That's why if more number of pupa is there, more danger is there.
Yes.
That is why we will calculate pupal index. Okay. So in pupa 1 or 2 days it will grow as adult. So it will be almost 7 days. 1 day, 4 days, and this is 2 days, like 7 days. So 7 to 10 days. Anyhow, they are feeding on male nectars and flowering. Female mosquitoes, they will soon after emerging, they will means maybe one day it will feed on nectars. First it will feed on nectars and blood. Then it will go and feed on blood only. After taking the blood, it will start laying the eggs. For laying of eggs, compulsory blood should be there. Otherwise, that mosquito, it is not going to lay eggs. After blood meal only, the protein which is present in our blood, hematin protein is required for the mosquitoes to lay eggs. Water source is required for laying eggs. That is true. Blood is also required. After blood only, it will lay eggs.
Freshly emerging mosquitoes will take in place.
Vector control methods. Now what we have discussed. Personal prophylaxis means personal measures, mosquito net, everything. Just I am showing you the biological control is fish, guppy fish, gambusia fish, some other plant products. This is chemical control, using of the chemicals. Okay, this is environmental management, source reduction. Okay, this is also important, health education and community participation. Okay. So integrated vector management, it is a rational decision making process to optimize the use of resources for vector control. What are all the resources are there to control vectors? We should integrate. Means biological, chemical. So that is all integration. Integration means samagra. Yes. Okay. It requires a management approach that improves the efficacy. So we should also control this. If it is too costly or too difficult to handle, we cannot do. It should be cost effective.
Available facilities.
Yes, available facilities and also the manpower. We should that way we have to plan our vector management controls. Okay, the efficacy should be increased. It means if we are spraying, if the efficacy means the larva is not dying, why to just you simply pour the oil. But the larva, if it is not dying, why to use? Efficacy should be there.
Yes,
So that's why we are using some used oils and mosquito larvicide oil. The efficacy should be there, cost effectiveness, ecological soundness, sustainability of the vector control interventions. So all these things we have to plan properly and we have to do the vector management. So in integrated vector control, it is the utilization of all appropriate technological and management techniques to bring an effective degree of vector suppression. The vector should be suppressed, okay, in a cost effective manner. Selective vector control is a method that is efficient at low cost and takes account of local situation. Means, suppose R is telling some dengue case is there. So immediately what should be done? Edis select only that particular location. Immediately now the team will go wherever the death happened. So for the local situation, selective vector control, they will now go house to house survey. Whatever are see they don't some ANMs are suspended because they have not followed dry day. So this is selective. Now it will be selective vector control. Okay. If it is a bigger colony or bigger village, we are doing whole village means it will be integrated. Means we are doing all. We are spraying. We are doing some fish also. That is integrated. But here some particular location, some death is that is selective vector control. Okay. So this is the again same biological control, larval fish, genetic manipulation, natural elements, whatever it may be. Whatever biological agents we are using comes under biological control. Whatever chemicals, adulticides, larvicides, biocides, insect growth regulators, they come under chemical control. Personal protection, health education. Health education is also important. So the health education means we are telling the people, local people, eggs will be there. You have to clean the container. If you pour simply water, no use. Again, if you pour water, the eggs will hatch. That is the beauty of the Aedes eggs. Okay, Aedes eggs no even they will stick to the container. If you pour the water, it will be it will dry. Okay, but after again you are filling the water, the eggs will hatch into larva. That is the
desiccation.
Approximately weeks పరిధిలో కూడా ఉంటాయి సార్.
No, up to 6 months I think.
Different vector control methods. The source reduction, intermittent irrigation, filling means whatever the drainages are there, those are all considered the source reduction. So these are all the managements. So under NCBDC, these are the recommended insecticides list. Okay. In the adulticides, DDT now the DDT use is stopped. Okay. Now they are not using DDT but using but acridam extract. You are using this one.
No, synthetic pyrethroid.
Synthetic pyrethroid. Okay.
DDT.
Temifos, killing the adults. Okay. These are all killing the larva. The mosquito larvicide oil, MLO, and Temifos. Mostly we are using Temifos EC. Okay.
Bacterial control, bacterial syringe.
So the mostly used one biological control is fish and bacteria. Chemicals means MLO. Simply oil we are putting. That is a chemical also. Then Temifos 50% EC. Insect growth regulators means pyriproxyfen 0.5% granules and diflubenzuron.
Yes.
These are insect growth regulators.
Now we are using that all.
We are using. Very good. So again, personal protection, we have to use mosquito nets and everything. We need to protect individuals from infection to reduce or prevent the disease transmission at community level, to ensure the prevention or reduction of mortality and morbidity. So these are some natural repellents. Okay, from the plant extract. Study అయితే అట్లా చెప్తుంది. సమ్ అంటే మస్కిటోని లోపలికి రానివ్వండి. ఇప్పుడు ఏదైనా విండోస్ దగ్గర పెట్టాం
లేదు.
So these are all some synthetic screens, oils, odomus. These are the repellents.
Wear full sleeves.
Yeah. Now protective using long sleeves. Okay. Insect repellent jackets, nets. Same whatever we are using. Treated bedsheet. You see mosquito nets or LLIN mosquito nets for distributed insecticide, long lasting nets. That is what insecticide treated nets.
Long lasting.
Insecticide nets.
Impregnated. Okay, sir.
So now other vector control, indoor residual spray is there. A large number of structures in the operational area have adequate sprayable surface. This IRS everything you know, the chemical list I know. Okay. So the large number of structures in operational area have endophilic ఏం చెప్పాము మనం endophilic అంటే endo. The insecticides in such situation IRS. So the mosquitoes are inside the houses. Whenever the mosquito is going to rest, whenever the mosquito is going to bite, everything we should know before going to the IRS. Okay. And the duration of the residual, what chemical you are using, what is the duration of that, what is the concentration to be used, everything should be comes under this criteria. The repellent effect, the safety. Now we are spraying inside. The people should not suffer. So everything, the criteria should be
less the lethal dose to human.
Susceptibility, cost of even the cost should be low. We cannot spray costly chemicals inside the house. So management of insecticide resistance, whether the mosquito is resistant to that particular insecticide or not, we have to see before spraying. Acceptability order, the smell should be not pungent, means it's somewhat pleasant, it should be there. So visibility of spray deposit, if any deposits are there, it should be visible so that we can clean. We should not, without visibility, we should not spray that.
Otherwise they refuse.
Yes. So efficacy and nuisance pests. Now space spraying. Indoor residual spraying is or space spraying is outside. Okay, some are exophilic. See?
The air.
Yes. If any outbreak is there, now start not any outbreak, dengue or any outbreak
We
is
are
there.
also doing it.
We will do, but both we are doing indoor and space also. In some airports, some sensitive areas, there we should do because international passengers are coming.
Yes.
Now
Tourist areas.
Tourist area. Now see why we are conducting EDIS survey. We are going to airports and seaports. Every year 2 times we are going. We are going 2 times. We are doing EDIS vector surveillance. Why? Because we have now some person from Africa came. Yellow fever is not there in India. If some person from yellow fever endemic area, Africa, he is coming to India. He is having that fever. If one outbreak comes, like COVID, it will small outbreak will turn into pandemic.
But
Because the mosquitoes are abundant in India, Aedes mosquitoes are there. Some person from example, I am telling yellow fever. So many fevers. See Kerala, how many Nipah came, West Nile, Zika, every outbreak they are coming because that's why our IHR, international health regulations, they have given one order. To every airport and seaport every 6 months, pre-monsoon and post-monsoon. So before rains and after rains we are going. We are seeing the Prota index and everything we will calculate. If it is more than 20 Prota index, that PHO, Port Health Organization, they will be seriously questioned by the IH division, means ministry. Ministry will ask them. Why you are not maintaining proper? Because if any international passenger comes, outbreak comes in India. So that is a burden to government and also for us. That is what we are doing. So the airport staff, they will take care of all the vector surveillance and everything. This space way, even the terminals are there. The terminals, wherever the passengers are moving, they will spray. That's why this space spraying is also important for the exophilic mosquitoes. Okay. Same criteria. Larvicide. Larvicide means which will kill larva is called larvicide. To control the vector larva population and prevent adult emergence, restricted and accessible breeding sites within the vector's flight range. See what each mosquito has its flight range. In dengue, what you are doing? How much? You see now you one case came.
50 houses.
50, not that is the how much? 500 meters. Yes, 400
meters.
Actually, because the flight range of Aedes is 400 meters. Okay. 500 is convenience కోసం 400 actual study. So even in airport or anything or Aedes surveillance, whenever if you see this dengue case, now you see 400 meters radius is compulsorily targeted from that house. 400 all around means from the circle. Yes.
Surrounding.
Yes. Okay. Because of the flight range of the mosquito. Aedes mosquito can fly up to 400. So this Anopheles and Culex, they also having some flight range around 2 to 3 kilometers. The study says 2 to 3 kilometers based on the mosquito, the conditions and also the 2 to 3 kilometers on an average. But Aedes, it is because of this size and everything, it will fly up to 400 meters range. So So that we are concentrating in that 400 meters radius.
But QLX, sir?
QLX and this is the list. Okay, I will not explain all the things. This list anyhow I will share you the PPT. This list will be there. Just overview. Mustard largicide oil we will use as it is.